Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, Sniffles Causes and How to Treat Nasal Congestion. The sniffles is a slang term that usually refers to nasal congestion, stuffy nose, nasal discharge, runny nose, and/or the minor illnesses associated with them, such as the common cold. The official term for a runny nose is rhinorrhea, which describes excess fluid, mucus, draining from the nose. This fluid can vary from thick to thin, clear to opaque, and intermittent to constant. /r/n/r/n A runny nose is a typical symptom of the common cold. Adults experience an average of 2 to 3 colds a year, and children even more frequently. /r/n/r/nLaylaBird, Getty Imagesrnrn Symptoms of the common cold can include /r/n/r/n. These symptoms usually peak within 2 to 3 days and can last up to 1014 days. At first, nasal mucus is clear but may change to white, yellow, or green after a few days. The color does not mean you have an infection that requires antibiotics. /r/n/r/n Symptoms of the sniffles can also be caused by rhinitis, irritation, and inflammation in the nose's mucous membranes. Rhinitis is often due to allergies, sometimes called hay fever. Symptoms of rhinitis include /r/n/r/n. Triggers for rhinitis include :/r/n/r/n. An excess of thick mucus can cause nasal congestion, but a stuffy nose usually results from the swelling of inflamed blood vessels in the tissues lining the nose. /r/n/r/n. Various things can cause a stuffy or runny nose, including /r/n/r/n. Infections, /r/n/r/n. Allergies, /r/n/r/n. Medications, /r/n/r/n. Physical/structural abnormalities, /r/n/r/n. Other conditions, /r/n/r/n. Other factors, /r/n/r/n. Some symptoms of the sniffles, like some common cold symptoms, can overlap with signs of COVID-19. For some people with COVID-19, symptoms can appear mild and be mistaken for a cold or other minor illness. It's important to watch for other COVID-19 symptoms, and not just assume it's a cold. If possible, take a COVID-19 test if you have symptoms, even if you think you have a cold. /r/n/r/n. If you have a cold, let it run its course while your body fights it off. Though you can't cure your illness, there are some ways to help you feel better while you're sick, including the following: /r/n/r/n. Talk to your healthcare provider or pharmacist about medications that may help with symptom relief.Cough. Cold and allergy medications can have multiple ingredients that may overlap or interact with other medications. Check the ingredients in all your medications and take them as directed to avoid taking too much or experiencing drug interactions. /r/n/r/n. Nasal sprays may make congestion worse if overused. Don't use over-the-counter nasal sprays for more than 3 days unless directed by your healthcare provider. /r/n/r/n. If allergies cause your nasal congestion, you can take measures to reduce your allergy triggers, such as /r/n/r/n. Talk to your child's healthcare provider or pharmacist before giving your child over-the-counter, OTC, medications. Some OTC medications can be harmful to children of certain ages, including /r/n/r/n. Runny nose and nasal congestion from colds usually resolve without issue. Rarely, acute untreated sinus infections can lead to more serious infections. When mucus backs up, it can drip down your throat and make it sore, leading to coughing. In addition, if excess mucus backs up into the eustachian tube, it can lead to ear pain or an ear infection. /r/n/r/n. If nasal passages are irritated or obstructed for an extended period, sleep, ear health, quality of life, and facial development, in children, may be affected. /r/n/r/n. A healthcare provider will conduct a physical exam and check the throat, nose, ears, and airways. If more than a common cold is suspected, additional tests may be run, such as /r/n/r/n. Sometimes, a healthcare provider may refer you to a specialist, such as an otolaryngologist, ear, nose, and throat specialist, or an allergist. /r/n/r/n. See your healthcare provider if /r/n/r/n. Seek medical care right away if you or your child experience any of the following. /r/n/r/n. The sniffles is a slang term for a stuffy or runny nose or the minor illnesses that cause them, such as the common cold. /r/n/r/n. Colds or allergies commonly cause nasal discharge and congestion. Colds can't be cured, but treating the symptoms with home measures such as saline rinses, staying hydrated, and getting plenty of rest can help. /r/n/r/n. OTC medications may help nasal congestion but should be taken as directed and with caution. Do not give OTC medication to children without checking with their healthcare provider or pharmacist. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.